Right now on Today in AZ, midwives give their own reaction to the I-Team's months-long investigation into one East Valley Birth Center after families submitted complaints about their traumatic births. Now, the I-Team's Jen Wall spoke to several midwives and state lawmaker about what they want to see change in Arizona.
And right now, one midwife is pushing our state for more oversight, right?
Yeah, there's actually several of them that want to see this. The midwives tell me they are frustrated with the Department of Health Services and want to see better communication and standards to make the practice of midwifery safer across the state. Morgan Burris, a licensed certified professional midwife in Arizona, does low-risk home births.
Yeah, I do roughly 40 a year, and I've been in practice a little bit over 3 years.
She's also the vice president of the Arizona Community Birth Coalition, a group pushing for more state oversight.
We are working toward legislative change in the state of Arizona to provide better regulations for midwives, better access to midwifery care, and proper oversight within our state.
Burris says right now the state makes it harder for midwives to do their jobs.
I now realize that it's pretty impossible for me to sustain a career under the conditions that we have right now.
Changes Burris wants to see start at the Arizona Department of Health Services.
We do not have proper representation at the Department of Health level. So we essentially have administrators regulating midwives. We don't have any sort of peer-to-peer oversight.
Burris says her push would ensure standards of care are followed.
Helping to make sure that proper enforcement happens when it needs to, and that we have a say in that, because right now we're at the mercy of people who honestly do not know very much at all about the practice of midwifery.
Their calls for change come as the 12 News I-Team revealed complaints about an East Valley Birth Center after families struggled through traumatic labors and deliveries. The nicest family losing their son in June of 2023, just days after he was born at the Willow Birth Center and rushed to a nearby hospital.
I feel a moral responsibility to protect other families from going through what I went through.
The nicest family brought their case to the state health department, who ultimately found what it calls a deficiency for failing to ensure fetal heart tones were assessed and documented. ADHS put a plan of correction in place for the Willow Center. A Willow spokesperson declined to comment on the ADHS findings, but did comment on the nicest family's lawsuit with the birth center in court. The Willow Center denied liability or responsibility, saying, "We hope this settlement gives the family peace as well as closure." Still, the nicest questioned whether the health department had done enough. The I-Team made repeated requests to the Arizona Department of Health Services for an on-camera interview, asking basic questions about midwife regulation. The interview denied, questions still unanswered.
What do you say to that when taxpayer dollars are going to ADHS and they're not responding to simple media requests?
One of our roles as legislators is to oversee state agencies. So when I hear of obstructions like that and there's not clear transparency, I want to look into that. So that's part of this process. Not only creating policy through legislation, looking at administratively what can we do without creating a bill, but also looking at this relationship with I'm hearing with ADHS.
Representative Selena Bliss says they're working on new legislation in the next session, focusing on midwifery care, including transfer of care between a midwife and hospital.
There's a lot of risk in that, and when you transfer care, it does need to be seamless for better patient outcomes, and those minutes and seconds are crucial. So I'm really excited to look at where we can improve on if we have to transport a mom and baby, what can we do better in that arena?
Representative Bliss, also a nurse and chair of the Health and Human Services Committee, says raising awareness is bringing bipartisan support.
Supporters on the House, Senate side, Democrat, Republican, we understand what needs to be done, and that's what we're here to do.
That support also encouraging midwives like Burris.
My options are move states or stay here and make change, and I'm not a quitter, so I'm here to make change.
So in addition to calls for more state oversight and improved transfer of care regulations, the Birth Coalition also wants midwives to be able to obtain, carry, and administer medicine within their scope of practice. Stay with 12 News as we continue to follow the developments on this legislation into the next session. For now in the studio, Jen Wall, 12 News.